So let's talk about Shigella with some slides. I'll get the first one up. And on that one, we start with what is Shigella? It's a type of bacteria. The Shigella family has 4 members. 2 of them tend to be more common. And actually, when we talk about Spokane specifically, the 2 more common, one more common than the other, are the ones that are causing most of the disease. As a general rule, people that are infected with Shigella will have symptoms between 1 and 4 days after exposure. The symptoms can be mild or severe and usually last up to a week, some people up to 10 days. Now, one of the issues why we have to be aware of it is because this disease can be quite severe, but particularly in young children, the elderly, and those that have pre-existing conditions or immunocompromised. And the diarrhea can last for several days, be quite significant, and have blood in the stools, which is one of the characteristics. So as a general rule, in clinical practice, when you have somebody with diarrhea that can be bloody, has fever and pains, and the pain can be also severe, we typically rule out Shigella first because, as a general rule, that triad is very typical for Shigella. The good news is that it can be treated. The bad news is that it can be quite severe and cause significant clinical illness, particularly those that get dehydrated and or have electrolyte imbalances. So it's something that if you do have any of the symptoms or know anyone that has complained of this diarrhea that comes all of a sudden and they have fever and stomach pains, please see your provider because you can be treated and things can improve fairly quickly after that. Now, how does it get transmitted? Well, notice that I mentioned already a couple of common denominators such as hygiene and lack of access and or access to contaminated places where people go to the bathroom. And the reason for that is because it's an orophycal route. As a general rule, the only way to have Shigella contamination is from feces. And those have to make their way into your mouth. And point of interest is one of those bacteria that has what we call a very low infective dose, which means you only need between 10 and 100 microorganisms to actually cause infection. That is a very low number. Now, it doesn't mean that you just put your hands in your mouth. It could be that you change a diaper. It should be that you touch toilet and or other common surface that had been infected. It could be in the water, survives several months in the water, and it could also be in surfaces. We do know that some studies have demonstrated the presence of active Shigella between days and months on surfaces. And the reason why that is important is because good hygiene is the best way to prevent spread of disease. If you look at the cycle that we have someone touching their mouth with presumably contamination. That contamination could have come from any other places that we talk about, like the bathroom, diapers, and or yourself, if, for example, you were not cautious. And that contamination can go to others, can go to food, like happened in the airlines, can go to surfaces, like has happened in other places. So it's very important that we follow some simple hygiene protocols to stop the spread of Shigella. And that explains why it moves so quickly, for example, in the 80s plane flights that I mentioned before. What I want to do is tell you a little bit of what have we done since we had the first case identified by our healthcare providers. So first of all, we've been in very close contact and communication and working very closely not only with our healthcare partners, but also with those in which we have people that can congregate, so some of like the shelters or meal services. We've also, through our food services, part of our environmental public health department or division upstairs, we make sure that all of our service providers and food providers, restaurants, had all of the information that they needed. We've sent at least 2 updates to healthcare partners, and we included early childcare education and schools when they were still open, just because it's not uncommon to see it in children once it's in the community. So in addition to that, we have provided a lot of education, including training for all of our partners that provide services. We have also distributed truckloads, and I'm not exaggerating, truckloads of materials, including things like hand sanitizer, supplies for people, including body wipes, undergarments, and a whole bunch of other things, just to make sure that people have access to clean clothing and ways to clean and sanitize their hands and surfaces. Now, we've also worked with the Food Coalition on making sure that all of our food establishments have the appropriate information. And I do have to say, knock on wood, our food establishments are being on point and doing a great job. So thank you to all of them. As we all went through the holidays, there was a lot of activity that involved food. And knock on wood, things have been pretty good thus far in there. But the reason why I mentioned that to you is we have been engaged since day one. We're still engaged. We actually just finished our situation report that has a very, very broad distribution in the community, providing people with updates on where are we at, where are we seeing, what types are we seeing, and what does that mean? Because one of the things that we do track is the antibiotic resistance patterns, making sure that our providers are treating people with the appropriate antibiotics. So now that we've talked a lot about providers and healthcare and others that are more on the service side of things, what can you do? What can anybody do? Well, it's pretty straightforward. Probably the most important, significant thing you can do is wash your hands before preparing food, while eating, and please, after going to the bathroom, changing a diaper, or cleaning a bathroom. I personally clean bathrooms with gloves just because it's me. I've been doing it for like 40 years. I'm not going to change. So there's disposable gloves, but don't trust that. Even after you take your disposable gloves, always wash your hands. Because, remember, those are not sealed completely unless you're wearing a containment suit, so things can get under the gloves. Now, if you have areas that are commonly utilized, make sure those are clean. And if there's any area in which there is exposure to human feces, such as public toilets, bathrooms, etc., and changing areas, make sure those are clean and sanitized frequently. One quick wipe once a day may not do the trick. Make sure that after every use, it's clean, and you do as much as you can. And by the way, that is just good practice, whether we're talking about Shigella or anything else. But now, because we do have this organism in the community, it's important that we are all up to speed on the best hygiene and sanitation procedures possible.